Hi folks, it's Marvin Music with MedicareSchool.com, and want to let you know that all the 2023 Medicare numbers are finally official. They're all out. And in this video, I'm going to share with you the new premiums, the new deductibles, the new copays, so that you have a full understanding of what you can expect in 2023. Let's get started. So I want to begin talking about Medicare Part A changes. Okay, now Medicare Part A is the hospital side of Medicare, the skilled nursing side of Medicare. It's pretty much everything that's going to be inpatient type services. And so the majority of people that receive Medicare Part A have no premium. And the reason for that is because you and I, through our payroll taxes, are funding Medicare. 1.45% of every dollar that we make right now goes into Medicare, and our employer matches that. So we're actually prepaying for Part A all of our life. And so as long as we or our spouse has at least 10 years worth of work, we paid into those Medicare taxes, then we'll get Part A premium free. And you'll notice in 2023 that's not going to change either. But I do want to note that there are some people that actually have to buy Medicare Part A, meaning they don't have 40 quarters, 10 years worth of work, or they don't have a spouse where they can get those benefits from. And so whenever someone has to buy Medicare Part A, there's a monthly premium. And so the way it works, it just depends on how many quarters you have. So if someone has 0 to 29 quarters, this year, Part A costs $499 every month. And people have to do this because where else are they going to get insurance if they're no longer working? And now, if someone has 30 to 39 quarters, then that rate is $274 on a monthly basis. Okay, and so if we have 40 quarters or above, we have no premium. And that, again, that's the most folks. But those who have to buy it, that's what they're going to pay. Now, as we get into 2023, those numbers are going to go up just a little bit. Anyone 0 to 49 is going to pay $506 for their Medicare Part A. If they have 30 to 39 quarters, that's going to be $278 on a monthly basis, okay? And so that's a minor change for those that have to actually buy Medicare Part A. And that's what we tell people, if you don't have a group plan and you're not qualified for this, that you want to enroll into Medicare Part A as soon as possible, because if you don't take Medicare Part A and you have to pay for it, then you're going to be penalized. And those penalties can be very stiff. And so you want to make sure that you enroll in Part A even if you have to buy it. All right, so that has to do with the premium for this year and next year. Now, as we talk about using Medicare A, again, this is the inpatient side of Medicare. So what this means is if I'm using Part A, it means that I am put in the hospital. And remember, if you're under observation at the hospital, you're still considered to be outpatient. So here we have been admitted to the hospital. And so what our responsibility to the hospital for Medicare would be a deductible. And this deductible actually covers us from 1 to 60 days in the hospital. That's a long time. And that's going to be probably 99% of every situation. So 1 to 60 days, I only have to pay my deductible. The bill could be 50 grand. The bill could be $1 million. It doesn't matter. Medicare says we pay the deductible. You and I, as insureds, we pay the deductible. Medicare is going to pay the rest. And so that deductible is not an annual deductible. It's called a benefit period deductible. And so that deductible can occur more than once in a year. So this benefit period is defined this way. I'm admitted to the hospital. Let's say I'm in the hospital 7 days. So I'm admitted, 7 days later I'm discharged. For the next 60 days, I am still in my benefit period, which means from discharge date for those 60 days, if I have to go back to the hospital, I am still under the same deductible because I'm still in my same benefit period. But if I'm hospitalized, 7 days goes by and I finally heal up, I go home, and then 60 days goes by and nothing happens to me that would cause me to be rehospitalized, but happens after that. And then I have to go back to the hospital, then I would start a new benefit period, therefore I would owe another deductible for that year. So this can happen multiple times in a year when people have some serious health issues. Okay, so that's all I have to pay out of pocket for the first 60 days in the hospital. Again, that's going to cover 99% of every situation. However, sometimes people are really sick, many times in a coma, and they're going to be in the hospital longer than 60 days. And we're talking about now continuous days. And so what happens is when I get into month 3, month 4, and month 5, now I'm going to be responsible for daily copays, okay? And that's what this is talking about here for 2022. As we get into 2023, what's going to happen those numbers are also going to change. But I want to clarify the fact that this creates what we call our second gap in Medicare. You're responsible for these extended daily copays. And then lastly, when it comes to Part A, skilled nursing facilities are covered through Part A. Now, by the way, this is not nursing home insurance. This is rehab. Somebody's had a stroke, maybe a hip replacement, and they're going to a skilled nursing facility. A very high likelihood they're going to recover, and so they're going for fairly intensive rehab. So here's the way it works. Medicare says if you're going to a skilled nursing facility, as long as you were in the hospital 3 days or longer, Medicare will pay everything for the first 20 days. It literally does not cost you a penny as long as you've had a 3-day stay. They call it 3 midnights. It's 72 full hours. And as long as we've had that before going to skilled nursing, Medicare covers the full tab first 20 days. But after 20 days, if I'm still in need of skilled nursing care, this intensive rehab, now what's going to happen from days 21 to days 100. So this is an additional 80 days, I am now responsible for a daily copay of $194.50. Now, right now, they tell me the average Medicare recipient is in a skilled nursing facility somewhere between about 30 to 35 days. So as you can tell, the average person is spending about $2,000 or $3,000 out of their pocket for that average skilled nursing stay. So these are what you're responsible for on Medicare Part A. We call these your gaps. Medicare pays, and pays, frankly, pretty well, but you're still going to be liable for these particular copays on Medicare Part A. Okay, so in 2023, the system's still the same. We still have a deductible, we still have a benefit period, we still have extended copays, but the numbers are going to look like this. So as I get into 2023, again, no monthly premium, of course, unless you have to buy it, and you understand what those are being adjusted to. Now, the deductible next year for a hospital stay is $1,600. So it went up, what, $44, so it didn't go up much, but now you're responsible for that for every hospitalization that occurs in 2023. Okay, remember, after that 60 days of being discharged, then that can reset and we could owe it again. Again, it's covered, yes, for the first 60 days. And then after that, if I'm in month 3, which would be day 61 to days 90, now I'm going to have a daily copay of $400. So if I'm in that whole month, that's going to cost me, $12,000. And then if I'm in month 5 and month 6, probably not conscious, probably in a coma, and then those daily copays are going to be $800 a day. All right. So as you can see, they went up just a little bit as well, about a 3 or so % increase. So that's for extended hospital stays. Now, I may remind you folks that after those 150 days, you have no Medicare coverage whatsoever. Medicare only covers you those first 150 days. And that's why a lot of people will get supplemental plans, because every supplemental plan that's available, all 10 letters that you can buy, A, B, C, D, F, G, K, L, M, N, N, all of those would give you an additional full 365 days in the hospital if you ever needed that. Again, that's rarely used, but it does happen. And so that's one of the benefits of a Medicare supplemental plan. They would cover you for a full another year at zero cost to you. All right, so that's for the hospital. Now let's talk about skilled nursing. Again, this is intensive rehab. Right now we have a $194.50 a copay days 21 to 100, and that is going to go up to an even $200. All right, and so remember, I said the average right now is about 30 to 35 days. So again, most people are going to spend $2,000 to $3,000 out of their pocket for their copay for those additional days in the skilled nursing facility. Okay, so this is the changes. These are the changes for Medicare Part A for 20 and 23. Now let's go and look at Medicare Part B.
Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare.
So in 2022, everyone that's been on Medicare has been paying a monthly Part B premium. We saw that A is free as long as we have 40 quarters. We're eligible for B if we have 40 quarters, but that's not going to be free. There's going to be a premium for Medicare Part B. Now that premium is taken out of your Social Security check. If you're receiving Social Security, if you're not, they will bill you for that quarterly, or you can set up a monthly bank draft called Medicare Easy Pay until you start Social Security. But the point is, everyone's paying a monthly premium for their Medicare Part B, and again, that is going to change in 2023. Now, in the present system, as we use Medicare Part B, which is called the medical side, which is basically everything outpatient related, all doctor-related services, whether that's a doctor you go to see in their office or they come to see you in the hospital, and all durable medical equipment. Those are the big items that are covered by Medicare Part B. Outpatient services, this would be lab and outpatient surgery, CAT scans, MRIs, those kinds of things. All the doctors that you see, your primary care doctor, your specialist, or those that come to see you in the hospital. That could be a surgeon, anesthesiologist, hospitalist, the ER docs. All those doctors are going to be paid to the B of Medicare, and then durable medical equipment, CPAP machines, oxygen equipment, diabetic supplies, scooters, wheelchairs, walkers, those kinds of things that you need are going to be paid to the B of Medicare. So again, we have this premium, which will go up, and I'll tell you that in just a minute. Now, when we're using Medicare Part B, again, we're going to have some financial responsibility. Medicare pays well, but we're still liable for some part of the bill. So we start off the year in January with the deductible. This year, that's $233. That's going to go down a little bit next year. And that deductible just simply means that the first bills that are coming through the B side of Medicare, again, docs and outpatient situations and durable medical equipment, that first $233 is going to be your full responsibility. And then after you've met that deductible, then Medicare is an 80-20 plan. Medicare is going to pay 80% of the bill, and you're going to be responsible for 20% of the bill. And that just simply means that Medicare is what we call a fee-for-service plan. Fee-for-service means that Medicare has thousands of services they cover, and there's a predetermined fee already established that the provider knows exactly what they're going to get. And of that fee, Medicare pays 80%, you pay 20%. So if we have a fee for service and it's $1,000, Medicare pays $800, and you're going to pay $200. That's your 20% we call co-insurance. Now, the problem with your co-insurance is this statement here. Your co-insurance has no maximum. In other words, it just keeps going and going and going. And the biggest problem is where the doctors are paid. So when people have serious illnesses and they have no other insurance other than A and B, this is really where they get in a lot of trouble, because that 20% never stops. So if you have a surgeon, there's an anesthesiologist that's part of the surgery as well. They're both, you're responsible for 20%. Every doctor that you saw to be able to get to the diagnosis, maybe a specialist to get to the diagnosis of this illness, you're going to pay those doctors 20%. And that's why, in my opinion, I would never have A and B only. You certainly want to get some kind of insurance to cover that, but that is your gap, your 20%. And then lastly, you'll see here it talks about an excess charge. Now remember, I talked about Medicare being a fee-for-service plan. Medicare has thousands of services they cover, a predetermined fee. Now, the majority of doctors, about 9 out of 10 on average, are going to take fee-for-service as payment in full. Whatever that amount is, that $1,000 I mentioned, they know that Medicare pays $800, you pay $200. So again, the majority of doctors will take the fee-for-service, but some don't. And when a doctor doesn't, they're going to add to the bill. And when they add to the bill, that is called an excess charge. And that amount is going to be 15%. Medicare allows doctors to do this, and when they do it, you have to pay for it. And again, just like the 20% never stops, if you go to providers that add 15%, that never stops either. And again, we can get insurance to cover that, but people who have A and B only, they will be responsible for all of these items. Okay, so now as we move into 2023, there's a couple changes here on the B side of Medicare. The monthly premium for next year is actually going to go down, and that premium is going to $164.90 a month. Didn't go down a whole lot, but it went down a little bit. Okay, and so now that's going to come out of your Social Security check, or they're going to bill you for this quarterly, or if you have Medicare Easy Pay, they do a bank draft and they'll take that out of your bank account. So we saw a slight reduction in the Medicare Part B premium. Now, I want to clarify something. This is what about 90 to 93% of all people pay. We call this the standard premium. However, there are some people that pay more. And so I want to clarify this. So this Part B premiums that we're paying is based upon what is called our modified adjusted gross income. So if I'm in Medicare in 2022, Medicare actually looked back at my 2020 modified adjusted gross income. We all know what AGI is. That's a specific line item on the tax return, adjusted gross income. Modified means they add back in what is called tax-free interest or tax-free interest income, and which is basically some U.S. savings bonds, maybe municipal bonds, sometimes foreign earned earned money, those kinds of things. You didn't pay federal taxes on, but you reported those on your return. So they take your adjusted gross income line and add back in that tax-exempt, tax-free interest income line, and that becomes the number Medicare uses to determine what your Part B premium is going to be. And again, they always look back 2 years. So this year, anyone that's on Medicare is paying $170.10 a month, provided that they're single filer. It's $91,000 or less. They would pay the $170.10. A single person that's above $91,000 is going to pay more. And in the scope of this video, I'm not going to go into that other than to say those additional amounts are called IRMAs. They're called Income Related Monthly Adjusted Amount. It's an acronym. IRMA, Income Related Monthly Adjusted Amount. It's a surcharge for people who are high income, what they're going to pay for their Medicare Part B. And that ranges anywhere from about $80 extra a month upwards to $500 a month if you're really, really high income. Okay? And so as long as we're below $91,000 this year, then we pay the $170. Now, a couple would be at $182,000. Obviously, it just doubled. So if they're below that $182,000 limit, again, each person that's on Medicare will pay the $170.10. Okay, now, as we get into 2023, these thresholds are going to go up, which we're glad for. So next year, a single person, that number is going to be $97,000. So as long as they're below $97,000, they will just pay the Part B premium that's standard. A couple, obviously they always double this, so we've got a couple who file a return together, a joint return. That's going to put them at $94,000. So $194,000. And as long as we're below that, then they will just pay the standard Part B premium. Again, if we're going to be above these amounts, we're going to pay an additional amount for our Medicare Part B, as well as there's an IRMA on the drug side as well. But again, that's going to vary on income anywhere from $80, and if you're real high income, maybe an extra $500 a month. Okay, so that's a change for 2023. Now, as we get into this next year, remember these deductibles reset every January. This is not a 12-month necessarily. It's a calendar year deductible. So if someone starts Medicare in July, that's their deductible for the year. And then it'll reset every January, and then they get a full 12 months. So this next year, this deductible is going to be at $226. So this means beginning in January, the first $226 of anything that you're spending on the medical side, which is the outpatient side, the doctor side, durable medical equipment side, you're responsible for the first $226. And then after that, nothing's changing. You still pay 20% coinsurance with no limit unless you have other insurance, and you still are going to have to pay the excess charge if and when that ever occurs. Okay, so these are going to be our numbers for 2023. And I want to clarify something. Many people who decide that they are going to stay in what we refer to as the original Medicare system, meaning they don't take an Advantage plan. They stay in original A and B. Because of the gaps that I just taught you on the B side and on the A side, most people are not comfortable with that amount of liability. And so what they can do is they can transfer that liability to an insurance company and pay a premium to the insurance company. The insurance company in turn issues to them a Medicare supplemental policy called the Medigap policy, and they can pretty much get rid of all the liability or most of the liability with a Medicare supplemental plan. So what's happening in plans is these gaps that I just taught you about are being covered by that supplemental plan. Now, most people today are buying an F plan, a G plan, or an N plan. Now, by the way, if you're born before January 1st, 1955, you can still buy F plans and keep F plans. If you're born after January 1st, 55, meaning you started Medicare after January 1, 2020, you cannot get an F plan. Okay, by the way, it shouldn't break your heart. They're not really a great value any longer anyways, okay? And so what's happened is the most popular plan today is a G plan. Okay, but what I'm trying to teach you is that when we buy a supplemental plan, whether that's an F plan, a G plan, or an N plan, all the gaps on the A side of Medicare are totally covered. Okay, there is truly equal coverage on the A of Medicare. Remember, we talked about the deductible that can occur more than once in a year, extended copays if I'm in the hospital longer than 60 days, and those skilled nursing copays if I'm in over 20 days. All those plans I mentioned, F, G, and N, have equal coverage. All those gaps are going to be filled. Doesn't cost you a penny as far as anything the hospital or skilled nursing can bill you. But when we come to the B side of Medicare, this is where there are changes between the F and the G and the N. And so the F plan, again, would be a full coverage plan. It literally, folks, would fill in all these gaps. It covers everything. As long as Medicare pays first, that F plan actually will fill in every single gap that exists. You should really never get a bill if you have an F plan. As long as Medicare pays, F picks up every gap. Okay, and again, you've got to start Medicare before January 1, 2020 to have that, which means you were born before January 1st, 1955. And if you can't, then the G plan is, as I said, the most popular. So here's how it works. Remember, the G plan covers everything on the A side. On the B side, what it does, it will cover your 20%. It will cover your excess. It just doesn't cover your B deductible. So when someone has a Med Supp Plan G, all the gaps are covered, A, and all the gaps on the B are covered, but that B deductible, which means the first $226 in 2023 is going to end up as a bill in your mailbox. That could be a couple doctor visits. It could be $226 of an MRI or cataract surgery, and then after that you have 100% coverage. And the reason most people that are buying G is because there's a lower premium than the F. Even if they could qualify for an F plan, there's enough premium savings or premium spread to more than cover that small B deductible. Okay, and then another plan, not as popular as G plan, but some people will buy, and that's called an N plan. And again, it's a different letter, so it's going to have different amount of coverage. And so what happens with the N plan is this. Okay, remember the G covered everything but the B deductible. The N plan, you would be responsible for the B deductible just like you're on the G. But here's one of the differences. The N plan doesn't cover excess. Now, by the way, there's about 8 states around the country where doctors cannot add to the bill. There's the other states where they can. And so there's some people that in states where they cannot add excess, then maybe they would like an N plan. Now, one thing about that, you may have to go to some specialty hospital, MD Anderson or Mayo Clinic or Cleveland Clinic, all these places where they're going to add to it. And so they may not be in your state allowed to charge excess, but you may end up going to a provider that still does that. That is a possibility. But the N plan would not cover excess if and when it occurs. And again, only about 1 out of 10 doctors do it anyways, but that's a decision that you're going to have to make whether you're comfortable with that risk or not. And then with the N plan, what you do have is every time that you see a doctor, you are subject to up to a $20 copay, and you go to the emergency room, you're subject to up to a $50 copay. So we're taking on a little bit more liability with the N plan. Premium is going to be a little bit lower as well. You have to decide. So again, most people are going with the most people are going with the G plan, some people are going with the N plan. All right, so the whole point is you can get all these gaps covered by a Medicare supplemental plan, or most of them covered by that supplemental plan. All right, and so that takes care of us on the A side and the B side for 2023. Now let's get into the changes for drug plans.
Hey, if you're on Facebook, you really need to join our MedicareSchool.com Facebook group. And the reason I say that is you can go inside that group, and every day, my dad and I are monitoring that, and we've got a couple other people on the team, but you can go in and ask your questions. And then every Monday night, we actually do a Medicare Monday, where Marvin or myself breaks down one important topic or one important part of Medicare and just explains it to you live. You can ask questions, all that sort of good stuff. So go ahead, look up MedicareSchool.com on Facebook, join the group, and you won't be disappointed.
Now, Medicare Part D plans are really one of the most confusing parts of Medicare. And so I'm going to show you the changes from 22 to 23. But before I do, I want to just quickly give you an overview of how drug plans are going to work, the structure of them, because there's so much confusion, and I want to make sure that you understand this system. So first off, what I want to do is I want to compare Medicare to what you have if you were still working, or an individual plan that you had, because Medicare plans work differently than group plans do, employer group plans and individual plans. The plans that were covered by at work, or again individual plans, what happens is they have what we call a one-stage plan. And that means that the insurance company gives us a formulary. Each drug that's covered is in the formulary, and it's given a tier number. And that could be a tier 1, 2, 3, 4, 5 usually. But a tier 1 on a group plan or individual plan, let's say it's a $5 copay. And maybe a tier 3 is a $50 copay. And so what happens is throughout the whole year, we pay this same amount. Whether I get the prescription in January or July or December, I'm going to pay $5 fixed copay all year long on those group plans and individual plans. A tier 3, again, $50, but again, it's going to be a fixed copay all year long. Very simple. So that's what we're all accustomed to. But when we go into Medicare, Medicare doesn't have one stage. It actually has 4 stages. And that just simply means that one medication we're taking could fluctuate in copays 4 times throughout the year. So we have fluctuating copays because we have 4 stages. Again, group plans, 1 stage, fixed copays, Medicare, 4 stages, therefore fluctuating copays. So let me show you how we move through the stages, and then I'll show you what the exact numbers are going to be that would cause us to move. So stage 1 is always the deductible stage. Now this deductible stage is the dollar amount that's set by Medicare. It's a maximum that any plan can charge for a deductible for that year. And what this simply means is you don't necessarily have to show up and just write a check for the deductible, but what's happening is any copays that you have that are attached to your medication will be applied to that deductible. And so some people reach it, most people don't, but if we ever do reach that deductible, then we move from stage 1 and we go to stage 2. Now Medicare calls this officially the initial coverage stage. And what's happening in this stage, you're just simply paying copays based upon the tier of the medication. Very simple. But here's what's different. As I am in these 2 stages, what I am doing is paying my copays, but Medicare is actually tracking the retail cost of medication. So I may have a $5 copay, but that medication may cost $100, or a $50 copay, medication may cost $500. So Medicare's tracking the actual retail cost. And so what happens is, as that retail cost begins to increase, as I get prescriptions throughout the year, if that retail total ever reaches a certain threshold, a certain dollar amount, and I'll show you what those are, but once we reach that retail threshold, if we ever do, then that would move us from stage 2 to stage 3, which is called the coverage gap, or we in slang call it the donut hole. Now the truth is less than 5% of all people even reach the donut hole, but those who do have reached it because they finally reach that retail threshold that Medicare establishes that causes them to finish out here and move to stage 3. And then now in stage 3, the donut hole, we just simply have flat 25% copays, 25% coinsurance for our copays. So we pay 25% of the retail cost here. Now Medicare is tracking another number. Rarely do people get to that, but those who do, I think it's about 1% of the population, then would be in stage 3 and they would move to stage 4. And again, now medications are very cheap. But what has happened in each of these stages is the same medication, I have a different copay. And that's why I was saying we have fluctuating copays. And then what happens, every January, these stages are going to reset, and then we start through the system again. Deductible, initial coverage copays, the donut hole coverage gap, and then catastrophic. All right, so that's how every drug plan is structured. Whether it's a standalone drug plan, a separate drug plan because you've got a Medicare supplemental plan, or you have an embedded drug plan with an Advantage plan, they will all have the 4 stages. All right, so here are the specific numbers for this year and next year. So stage 1, that deductible stage, deductible is set by Medicare. This year it's $480. Again, it's an annual amount. Copays are applied to that. Now keep in mind, most of the plans, what they do is they actually waive that deductible for medications that are going to be tiered at tier 1 or tier 2. Most common practice we see. Now this deductible is going to go up next year. It usually does go up a little bit, and that's $505. So we see a $25 increase from 22 to 23. Again, most of you are not going to reach that number, but those of you who do, the first 505 is going to be actually out of your pocket. Again, tier 1 and tier 2 meds are going to be waived as far as deductible is concerned. Okay, that takes us in to stage 2. So if we've met that deductible or that deductible is waived, then we're in stage 2. So what happens in stage 2 is we're just simply paying copays. Now this year, that's kind of a range between tier 1 through 5. Next year, we're going to probably see a few slight increases on meds, not a whole lot, so we may see a couple of copays go up. But again, what's happening here, remember, Medicare is tracking the retail cost of all your medications, and so as that number continues to increase, then there's a possibility that you will leave stage 2 and go to stage 3. So that retail threshold this year is $4,430. Keep in mind, you did not pay that. That is not out of your pocket. In fact, you may have spent $1,000, probably at most, of that $4,430, but Medicare is tracking the retail cost. Now, keep in mind, let's say someone's on a medication that costs $500 a month, and that's the only one they take, or maybe all their medications combined retail are $500 a month. How many months would it take to get to the threshold? About 9 months. 500 times 9 would be $4,500. So by the time we hit it around September, we've reached the retail threshold, and if we we do, we're done in stage 2, we're going to stage 3, which of course is called the donut hole. Okay, so next year, this number is going to change. It usually goes up a little bit every year. So the retail total, the retail threshold next year will be $4,660. Again, retail amount as they collect. Now, keep in mind, if you're like most people, you want to get close to that. Let me give you an example. I just had a guy wrote recently that has a medication that literally costs $16,000 a month, every month. So how long does it take to reach there? About 1 week, and then he's in the donut hole, okay? And again, most won't reach that, but that retail threshold is going to go up a little bit for next year. All right, so now we've reached the retail threshold if we do, and now we're going to be in the what's called the coverage gap, or we call it the donut hole. Now, this year, what's happening in the donut hole, we're going to pay 25% of the retail cost of medication. So if I'm in that gap, what does that mean? Let's say I got a retail medication that costs $500, I pay 25%. That means I got $125 copay for that medication. In stage 1, I may have paid $50. In stage 2, I may have paid $25. But now in stage 3, I'm actually going to pay an actual retail cost, 25% of that medication. So it's 25% of whatever the retail cost is. Now, in this particular stage, what's happening is Medicare is tracking another number. And so what this is all the money that you've spent out of your pocket thus far. And again, that's not retail. It's just out of your pocket expense. And then when we get here, what they do is the manufacturer is required to give you a 70% discount on your medications. So you pay 25%, the plan you're on pays 5%, but that manufacturer discount is 70%. And that 70% discount is also applied to this number. So that's everything that you have spent out of pocket thus far, and every drug in the donut hole has been discounted 75%, and so that number is credited in as though you paid it, even though you really did not. Okay, so again, most people never reach that number, but if we ever do, then we're going to go to stage 4 called catastrophic. So next year, again, copay is the same. We pay 25% of the retail, and then this number here is going to $7,400. Okay, so that's how long we'd be in the donut hole. And again, most people don't reach that. Those who do, they say about 1% of the population will reach catastrophic stage 4. Let me show you those numbers. So in this stage, everyone's a happy camper. And the reason for that is because medications are very, very inexpensive. And so the way it's going to work this year, of course, in 2022, you pay 5% of the actual retail cost, or just some fixed copays for your medications, whether they're generic or brand name. So you pay the greatest amount. So if I'm on a medication, let's say that retails for $1,000 a month, I would pay $50 for that medication. 5% of $1,000 would be $50. If I'm on a medication that is, let's say it's a brand name and it retails for $100, 5% would be $5, but because it's a brand, I would actually pay $9.85 because I pay the greatest amount, either 5% or the actual fixed cost of the brands and the generics. Okay, now as we go into 2023, same thing's going to happen. We pay 5% of the retail cost, or these have gone up just a little bit. Our generic medications will be $4.15. And our brand name medications went up 50 cents to $10.35. And again, very, very inexpensive, very reasonable. No one's upset whenever they get to the catastrophic stage. All right, now I do want to mention something that's not for 2023, but for 2024. What's going to happen here is in this stage, if you ever get to catastrophic, there will be 0 copays beginning in 2024. Obviously, we're not there yet, but that's something that some recent legislation was passed that we'll see enacted in 2024. All right, so these are the changes that are occurring in 2023. Now, folks, just in closing, I want to make sure you know that if you need some assistance, I know there's a lot here, and if you need someone to help you, it'd be our privilege to be able to help you in any way that you'd like. If you're going to be new to Medicare, we'll help you with myssa.gov accounts, help you enroll in Medicare A and B, we'll help you with your Advantage plan, your supplemental plan, your drug plan, making sure that you're going to be on the right plan for you. Okay, and so we take the time to make sure that we do a thorough research of all the plans in your area. We are brokers. No broker writes for every single plan. No one does, but we write for the majority of plans. Any plan that you would want, we write for those carriers. So what we do is we take all the plan options and we lay those side by side, making sure sure you understand what all your options are with no pressure, just simply giving you the knowledge you need to make a good informed decision. And we'd be delighted to help you to get enrolled in Medicare as well as select the right insurance plans for you. And then we have a customer support team as well whenever you have any kind of issues. And all of our costs to you are zero. Any agent that works with you, whether it's us or someone else, will be paid by the insurance company. And the price is always the same. Insurance companies set the prices, agents, we just simply write them, so there really is no difference. So you can't save any money with any particular agent. It's all the same prices because the insurance companies have established that, and they always pay us, not you, when it comes to the commissions. And so reach out to us if we can help you in any way. You can go to MedicareSchool.com, schedule an appointment with one of our guides, or you can call the 800 number, 800-864-8890. It'd be our privilege to assist you. Thanks so much for watching.